Hello, my name is Eli Cannell and I'm a student at University of Buffalo. Today I'm going to be going over the nasal swab practical. First thing is to get your supplies, which for this practical is just a simple nasal swab. In the real setting of patient and caretaker, you would have personal protective equipment for myself. So I would glove up and use PPE as such, but in this scenario I'm working on myself, so I simply can just do the procedure. In a patient setting, once you are equipped with PPE, you would evaluate the patient and ask if they've had any surgery on their nose. Just ask, have you had any recent surgeries? And assuming the answer is no for this scenario, you would then tell the patient what to expect. You can tell them, I'm going to swab your nose for a sample. It might be slightly uncomfortable, but not the worst thing in the world, just a little bit of pressure. And then with that said, you can then begin the procedure. As the caretaker, you're going to want to sanitize up. This is hand soap from my house, so I'm not actually doing it. But for the sake of the demo, I have displayed that I would put hand sanitizer on. Next, you want to get the patient in position. You should get their nose to about eye level of you. So my eyes are here and their nose should be about here. You can instruct them to look forward, but also close their eyes, whatever is most comfortable for them. And then you want to inspect and see if they have any sort of deviated nose, deviated septum in any way. You would inspect their nostrils and see which one has more buildup and more secretion, and that would be the nostril you pick for your initial swab. So now with the evaluation done, we can begin the actual sampling. You're going to take your swab and open it. Best to open from the bottom. And then you take it out. With your dominant hand, which for me is my right, you want to hold, I like to hold near the middle and between your thumb and forefingers, like such. And you're going to insert it about 1/2 inch in your nostril and swab around for 10 to 15 seconds. As I said in the evaluation, for a patient, if they have one side with more secretion, start there. I'd like to think I'm pretty even, so I'm just gonna go with this side to start. And you do this rub around for about 10 to 15 seconds and then switch. And then you put the swab in the transport medium. So with all that said, I will demo it right now. And I'm gonna look at the recording timer to make sure I get a good amount of time. Like I said in the eval, it's slightly uncomfortable, but shouldn't be trouble for any patient. That's been 10 seconds, so now I can switch to the other side. And that's 10 to 15 on the other side. So with that done, I would place this in the transport medium, which is to my theoretical left for this video. And that would be it for the nasal swab. Thank you. Next up is the buccal sample. So first you're gonna grab all your supplies, which for this practicum is simply the nasal swab. And then you're gonna grab your PPE. Since I'm working on myself, I personally don't need any, but if I were working on the patient, I would grab gloves and glove up. With the patient, which I don't have for this video, but in a patient and caretaker setting, I would first evaluate the patient. I would ask, have you used any nicotine products? Have you eaten or drinking anything in the past 30 minutes? Or have you used any mouthwash or brushed your teeth in the past 3 hours? If they answer yes to any of those, then you should instruct the patient to wait for better results. If they come prepared and have not done any of those things, you are going to tell the patient what to expect. You're going to tell them that you're going to swab the inside of their mouth to collect a sample, and it should not be any discomfort like the nasal swab sort of was. Next, you're going to sanitize your hands, and then you need to get your patient in position. So their mouth should be at your eye level, similar to how their nose was for the last practical. Have them look straight ahead and encourage them that they can close their eyes. So with the evaluation done, you can begin the actual swabbing. You're going to take the swab and open it up from the bottom side. Love that noise. And then with your dominant hand, you're going to insert the swab into the little cavity in your inner cheek. You're going to rub around for about 5 to 10 seconds and then do the other side. Watch out for any teeth or tongue or lips or any other non-buccal surfaces in the mouth. So I'm gonna show you how this goes, so then you can go and do it on your patients or something. It's kind of weird to do it on yourself. That's what we're here for. So using the clock up here, that was about 7 seconds. You want to be between 5 and 10. Now the other side. And there you go. You would put this in your transport medium, and then you're all set. That's the buccal sample.